This video continues Chapter 12 of OEC 6, looking at substance abuse and poisoning, and specifically we'll talk about the entrance of a substance or a poison into the body. There are 4 ways, and we'll look at 4 routes of absorption. So some of the key terms will be absorption, and we'll contrast the idea of ingested, inhaled, and injected poisons. So anatomically, what we want to consider are these processes that can occur, the absorption of the substance initially, how it moves throughout the body, how it may be processed and eliminated. Let's focus on the first piece, the entrance of a substance or a poison into our body, and that's absorption. There are 4 routes, and these are very similar to the ways that disease pathogens enter our body. They can be eaten, they can be inhaled, they can move across the skin barrier, or they could be injected. So ingestion is intake through the mouth, and absorption occurs through the gastrointestinal tract, including the very delicate mucous membranes of the mouth. This is a pathway through which substances can be absorbed, in fact, very quickly. Now keep in mind that those mucosa can be pretty delicate, and so consequently they could be damaged by contact with the substance. Think of an extreme poison such as an acid and the consequent burns that could occur. Now if the stomach is full, it can slow the rate of absorption. Remember, little absorption will occur in the stomach. That is not its job. It's principally digestive. Absorption occurs where we have that high surface area in the small intestine and somewhat in the large intestine as well. If the stomach is empty, we'll move the substance more quickly to the intestines and speed up the absorption. Substances not absorbed will be eliminated from the body. Now, deliberately, in a therapeutic sense, we may actually control this absorption. Think about medications that are taken positively and therapeutically that, for example, come in coated caplets, allowing for extended release. The second pathway into our body is inhalation. That is absorption through the lungs. And so that could be nicotine, it could be carbon monoxide, other gases that may be poisonous. But also keep in mind, similar to ingestion, we have very delicate tissue lining this respiratory pathway. And so if you inhale a corrosive substance, some sort of fumes, you can damage that tissue and the body's response will be swelling or bleeding. Now, once the substance travels through that inhaled pathway and moves through the alveoli and into the bloodstream, it can then move to other body systems. Transdermal absorption is occurring across the skin. The skin is highly vascular with many small capillaries and a high surface area, and so consequently we can absorb particular medication if it's therapeutic or substance or poison this way as well. We see this, for example, with nitroglycerin patches that a cardiac patient may have on their chest. The final pathway to consider is injection, and that typically involves the use of a hypodermic needle, and we can place that into the body's tissues, including into the underlying fat, which we would call a subcutaneous injection, or intramuscularly as well, which is a little bit deeper. Injectable medications are given this way, even something like a vaccine that you may get annually for the flu, but also consider this is just a route, and so arguably a bee sting or a snake bite are the possibilities for injected poisons as well. Now, physiologically, we've got the substance or poison into our body. The next step is to distribute it. And so the distribution could isolate the effect of that poison or substance to a single organ system, or it could be systemic and affect the entire body. This is after it gets transported to the site where it exerts its effects. Well, let's look. Acetaminophen, Tylenol, can have an isolated effect on the liver if it is overdosed and could result in liver failure. An overdose of heroin, which is a central nervous system depressant, could lead to a more systemic problem by completely leading to respiratory failure, loss of the airway, and cardiovascular collapse. Distribution is affected by several factors. It's going to move through the entire circulatory system very rapidly, but we also have possibility where barriers will limit or prevent distribution, such as the blood-brain barrier. Now, one of the final pieces then is metabolism. That's the processing or the breakdown of that substance or poison by the body. Primarily, that occurs in the liver. If you have liver disease or injury, that's going to prolong the time for metabolism simply because its function is diminished. Now, substances may not be completely broken down by the liver in one pass, and so it will just recirculate, and further breakdown occurs through repeated metabolism. Finally, be aware that benign substances can actually be metabolized into harmful ones as well. Elimination is that final physiological step, getting rid of the substance through either urine or the gastrointestinal tract, or through exhalation of the lungs, or even across the skin by sweating. Anything that impairs the functioning of these organ systems is going to reduce the rate and slow down elimination.